Alright guys, we're back. I do apologize for the ricketiness. We're in my place, you know, up on the, you know what I mean, we're upstairs, and unfortunately I weigh a ton, so I'm walking past the camera, that thing's gonna jiggle a little bit. Anyway, alright, let's get this thing done. So the next one, this is the other one we were talking about. Do you remember the name? Alright, CBC, complete blood count. This is that one I was telling you about that we want to look at like a cross, right? So straight up and down. Anybody remember what that was about? That was looking at your red blood cells, and we call those the erythrocytes. And then from side to side, right? That's addressing not the erythrocytes this time, but the white blood cells and platelets. Yeah, so good stuff. Complete blood count. So now, here's the fantastic part about it. Wow. So, remember in the previous video when we were talking about the coax, do you remember those numbers? The number for the PT and the PTT, right? What were they? PT was 14. PTT was 44. Well, lo and behold, in this one, you get to drop those numbers down into this same diagram, and it's going to be 14 here and 44 here. All right. Okay, so anyway, let's reel it back a little bit. Just wanted to let that get in your mind and marinate. 14 and 44. Okay, so now, again, as we're setting this thing up, we're starting with what's the main thing that people are talking about in the hospital or at your school when it comes to the complete blood count. What do you hear people saying all the time? H and H. What's the patient's H and H? Oh, right? So yeah, what goes in there? H and H. And what's the first one? Hemoglobin. Why? Think about your ABCs. Airway, breathing, circulation. What is that all about? Oxygen in one way or another. Airway, breathing, circulation, ABCs. So talking about oxygen. And remember, the hemoglobin would take that primary spot because it's the red paint that's on your cells. That sticky red paint that's all over your cell that helps the oxygen to stick to it. And that way it can carry it to tissues and things, right? So, yeah, hemoglobin, a red paint. Now, underneath there is the hematocrit. Now, the hematocrit, what you want to think about when you see that, you can switch it up a little bit in your mind and call it hema count. Because your hematocrit, that's what that's about. Your number of cells. Now let's pause there and take that in properly. So if we look at each cell, and we're looking at how much, or how sticky that red paint is on covering each cell, then that's great to know. But then the next question is, how many of those cells do you have? So hemoglobin on each cell, and what? Hematocrit, how many? Hema count, how many? Yeah? Okay. Now, and what were those numbers again? 14 and 44. All right, you're killing it. Good stuff. All right, now, next, we said side to side. What? White blood cells and platelets. Now, when it comes to the white blood cells, let's see. Ooh. So we can't use our 14 and 44 for this one. But check it out. What can we do? Well, we can do this. We can spell out the word white, right? Because we are talking about WBC, all right? And the word white, if we spell it out completely, has how many letters? 1, 2, 3, 4, what? 5. Our magic number, 5. And remember, we said we were going to add that letter K to represent thousands. Wow. Whenever we're talking about protecting the body, thousands of cells. 5K. And then what we're going to do? Double it. So 5K times 2 will take us to 10K. 5 to 10K. That is your range for your WBCs. How about that? Just build off your letters, right? WHITE. 5 letters, double that thing. 5 to 10K. All right, now, that was over there. Then we had H&H, hemoglobin and hematocrit. What was that again? 14, 44? Got it. 5 to 10K. Now, over here, platelets. When it comes to our platelets, all right, our platelets, which come together and form almost a web-like netting, one on top of the other, until they stop your bleeding, right? So our platelets, what do you want to think about with that? Is if you were going to Dollar General or the General Dollar Store and buying plates, how much is each plate? $1.50 a plate. $1.50 a plate, let's see, so $1.50 for each plate, and we're going to apply that $1.50 to each of the 3 letters in the abbreviation. So 150 plus 150 would take us to 300, right? Then another what? 150 would take us from 300 to 450. Absolutely. That is the range for your platelets in your serum. Okay? There we go. So our complete blood count, we said, right? What do we start out with? Our hemoglobin. That all important red sticky paint on each cell, helping to carry that oxygen there, right? And then now, let's add a layer and say that that paint has iron in it. It's a very fascinating thing to see too. You know, for myself, if you're anything like me, starting an IV when I was a brand new nurse, right? You start that IV and you're so excited about it, you're ready to do like the happy dance or something. You got that IV, and the patient's bleeding a little bit down the side of the bed. Just a little bit, right? Then that blood hits the floor or something, makes a little puddle, tiny one. Anyway, you got to clean that up. So you're happy about your little IV start, but there's that puddle of blood there. You got to clean that up. And what they like to clean the blood up with in the hospital is a 1 to 10 bleach solution. Then you come running with that bleach solution and you spray it on the blood, right? And when you spray it on the blood, it gets foamy and turns black. And you're going, whoa, 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 whoa. What's up with that, right? Okay? What happened? The bleach stripped off all of the red color and exposed all the iron that's in the blood, right? All the iron that's in that hemoglobin paint. So yeah, and then by the way, let's thread this needle for those who may not understand. When that bleach stripped the color off of the blood and turned that area black, right, and exposed the iron, that's the very same thing that we're seeing when you have a patient that has a black stool. That black stool looks like charcoal, lumps of charcoal. What's going on? Your patient's bleeding on the inside. And the hydrochloric acid in their stomach is acting like that bleach and taking off that red coating and exposing the iron. So they're having an iron-laden stool. Yeah, that's the melena. Black stool, black tarry stool, tar looking. Okay? So, good stuff. So hemoglobin and hematocrit. And then we've got our WBCs, and then we said what? Thousands, so we put that in K. And now, why do we say K? Because we're protecting the body. And in this instance, too, what happens? What do we say your platelets do? Stop your body from bleeding out. What are they doing? They're a layer of protection, too. And what do we stick next to them? K. 150K to 450K. And that, ladies and gentlemen, is your complete blood count. All right, stay tuned.